This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank. I am Rich Spicer. Katie Huckle is my co-host.
That's right.
And today the focus is on mental health, and it really needs to be.
Yes.
This time, right now, the mental health situation in our community, and really communities all across the country, is not the best.
That's right.
So we've got Donna Norkoli on with us. She is the Regional Health Planner and Coordinator for District Health Department number 10 and is based right out of Cadillac here. Donna, welcome to the show.
Thank you.
So you recently, the agency undertook a study that has had to do with perceptions of mental health, and you did a little fact gathering.
Right.
I don't even know how to start except to just jump right in. So what about your findings were surprising, maybe weren't surprising, and let's just build from there.
Okay. Well, we surveyed people in 10 counties of Northwest Michigan, and so Wexford and Missaukee were included. And we received 1,117 responses. So we felt pretty good. We got a great response to our survey, and we were trying to determine people's attitudes and awareness regarding stigma towards mental illness, because that's a big problem. And when people feel stigmatized, or they feel like they might face some discrimination, they are not going to seek help for a mental health issue.
Mm-hmm.
So we were trying to see, what are people feeling about towards people with mental illness, and how can we help and provide some education to try to reduce that stigma.
It's the affliction that people can't see.
Mm-hmm.
So
Right.
that's the major
Sure.
the major issue. Did some of your research figure out a root cause of this, or was it just mainly meant to address opinions and stigmas?
Yeah, mostly to address opinions and stigmas. So we asked if the respondent had any personal experience with mental illness or knew someone experiencing mental illness. And
That's a big question to open with right there,
Yeah.
because all the answers are going to be affected by that.
right.
Okay.
So we had about 60% of the respondents saying that they did know someone who felt unsafe telling others about a mental illness. So that right there was kind of a red flag, saying, over half the people feel unsafe telling someone about it if they have a mental illness.
Mm-hmm. That means there's a lot of people out there that need help, and we don't know how to help them because they don't want to.
Correct.
Oh boy.
Exactly. There's a lot of people being untreated, and of course, that can lead to bad consequences. If you're not mentally healthy, you're not physically healthy, you don't function, it just impacts everyone's life.
Donna, I'm sorry, go ahead.
For the worst, I guess.
Mm-hmm. I'm curious, when you got all of those over 1,000 surveys back, how does that compare to other surveys? Because, it's alarming, but it's also good that folks responded, right?
Right.
Okay. And then, so you've got that number of 60% of people know of someone that doesn't want to talk about it because of the stigma, whatever. What other questions were on the survey that really educated you guys on next steps?
Well, one surprising thing, we asked whether they thought stigma was an obstacle to seeking treatment for mental illness, and 93% agreed or strongly agreed.
Oh, my.
So again, that confirmed the fact that people are out there afraid to seek treatment.
Donna, can I ask you, what especially now that we've been through COVID and I think we all know someone that got sick and all know someone that got scared and we were scared. I mean, why now is this coming to the forefront? And what do you do as a district health department to help people?
Well, I don't know if it's just coming more to the surface since COVID. There's always been stigma and people have always been afraid, but I feel like maybe there's more of a focus on it because people were isolated with COVID and people are feeling a lot of stress right now. People were out of work. People couldn't find childcare. There were a lot of issues that just really exacerbated someone's mental condition. And not that stress causes mental illness, but it can truly, make things worse.
Donna, did your survey break this down by age? I'm curious.
Yeah, we did. We had about 35% of people that responded were 25 to 39 years old, and 44% were 40 to 64 years old.
Okay.
So other than that, it was kind of I guess it was heavy on the 25 to 64-year-old population that responded.
And the reason why I bring that up is because in my day-to-day life, I work in the classroom. I work with high school juniors and seniors, and I have to tell you, in the last few years, especially since COVID, and it wasn't good before pre-COVID, but the mental health generally amongst teenagers has gone absolutely down the drain.
Yeah.
And that's so difficult to come to grips with, because you have the people at their very youngest age who are struggling with mental health, who are struggling with what to do. It's also at an age when they're impressionable anyway, so they're even less likely to talk to their friends about how they feel or seek help. Right. So with all this information you gathered together, Donna, what are you doing with it?
Well, right now we wanted to get the survey results back out to the public. We don't want to take a survey and do nothing with it.
Right.
So we created a social media campaign through our Facebook page where we highlighted some of the survey results. And we also put, with that post with the survey results, we put a call to action. So we gave some links to some websites like the National Alliance for the Mentally Ill that has a lot of resources. There's resources about Pledge to be Stigma-Free. There's resources about how to help a friend if you know someone who has mental illness. So, and then we put a link to our Behavioral Health Initiative website that has some resources. So we tried to give people resources and call to action about, why the stigma is damaging to people and why people need to just seek treatment and not try to hide mental illness, because it just makes things worse. We also created some video, and we've now broken it down. We created a 5-minute video of several people telling their story of mental illness and how they actually decided to seek help and how it's impacted their lives. And so that was, we had 5 or 6 different people telling their stories, and we broke that down into 1-minute video clips so that we could use those in our social media campaign to link the shorter video clips that people would watch. And one of them is a high school student, and so she gives a pretty powerful story about, how she came to grips with her mental illness and telling people that she had problems and how she feels better about herself now. So,
And I can tell you, Donna, from my experience, it isn't necessarily just those kids who have had hard childhoods. Even the most well-adjusted kids
No,
have struggled in the last few years.
no, it's all walks of life.
Mm-hmm.
Yeah, it's not from, broken families necessarily, or, it's everybody. And it's people that, you think, oh my gosh, why would they have problems?
Mm-hmm. They seem like they've got it all figured out, right? Yeah.
Mm-hmm, mm-hmm.
Donna, let me ask you, do we have enough mental health professionals in the community?
No, we
Okay.
don't. Yeah, that's always an issue. And it's a big issue finding a psychiatrist, especially,
Mm-hmm.
because some mental illnesses, counseling is fine, but a lot of times people do need medications to get their brain chemicals back into,
Sure.
it's a brain disease. It's just like if you have diabetes and you're not making insulin, or you're making too much insulin, you need it regulated. So same thing with the brain, the mental illness with the brain chemical imbalances. So, and especially pediatric psychiatrists are very, very scarce and very rare. And, I've heard people talk about, they couldn't get in to see someone for months. And so that's a problem.
We talked to Jen Brown a few months ago, our superintendent of schools. And what she explained is, to staff for this, you've got to know that it's coming. And then when it lands in your lap and it's a problem, you're scrambling to staff for this kind of thing. And I think we see that, in a broader spectrum, in all of our communities, in that,
Right.
you folks have identified a critical issue. How do we get enough professionals to help people? And, to calibrate to that is difficult. So I think you've made some serious headway. And it's interesting, when COVID did first hit, and I remember Rich saying, this isn't where you get out on Facebook and ask your Uncle Larry what he thinks about things, or find facts from just same with, and so we would direct people to the district health department. And on something like this, again, this is sort of a forgotten population, mentally ill and mental health. We've seen lots of closed facilities. We've seen, we don't really have a place or a mental health a place for folks to go in terms of hospitalization here in Cadillac. Where are they going to go to? And so we need the pros, and facts are friendly, to give us information so that we can we can staff, we can help, and we can find resources for these people. So thank you so much for leading the charge and educating us.
Well, and two, we're now working with Munson Healthcare to bring trainings to their healthcare providers. Sometimes there's issues, and especially when someone presents in the emergency room. If staff isn't equipped to handle a mental health crisis, sometimes it can be an unpleasant experience. So
you could easily say the wrong thing.
Sure.
As a healthcare worker.
Right. So we want to bring a training. There's evidence-based training that NAMI has called Provider Education. And it's a team of people with lived experience providing some education for healthcare providers, based on what they've experienced. So we hope to bring that there this summer. We're trying to get, we have a group that's willing to be trained as facilitators. We just need NAMI to bring the training to us.
Yeah, and Donna, we do need to go to your website and check it out. But Rich and I talk to a lot of people every single day in our jobs. And what do you say to a friend that, I've been on the same antidepressant and I'm not feeling better, or to someone who has suicidal thoughts, or someone, what's the right thing to say?
Oh boy, that's a tough one. Sometimes it's just best to listen
Okay.
and show that you're there and you'll support them with whatever they decide.
I think that's I think that, Donna, I think that's really good advice, because in my experience with some of the kids who have been in trauma and who are suffering from anxiety, it's true. It's always been my experience that you're not a problem solver. But if you're a listener, if you're just sitting and listening, paying attention and saying things like that must be hard. You're doing a lot more than other people are.
Well,
in a way.
And exactly, you're not a problem solver and you're not a professional.
Right.
Both. I mean, you don't want to. So, okay, good. So just let them know that you're feeling empathy and, that you're listening. Okay, good.
Yeah, they need to know someone cares and someone isn't
Judging.
looking down on them or thinking that, yes, judging them. Yes, exactly.
And I've had that experience before where I've, talked with certain students and talked with people, and they have said, I feel like you're not judging me, and you're not necessarily validating my feelings, but you understand that I'm not making this up.
Right.
Right. So,
and then maybe we need to be directing people to this website to talk about these resources. We've had Dr. Jim Whalen on the show several times, and we asked him, how to build mental health resiliency, independence. And he talked about, practicing gratitude, but he also talked about interpersonal relationships, which is what we're getting at here, in that does someone have a safe person that they can share with. And then, if I was that safe person, I would want to get onto the website and say, have you ever looked at this as a resource? Have you ever thought about reaching out here, or, going into like a group session where people are talking about this same issue, if you have that be past trauma or an addiction or whatever. But you're right. Let's get them to the professionals, and that facts are friendly in terms of getting people the right help.
And I think it's really important, Donna, for people to know that they're not alone. And so what kind of things can they find from your survey that you've posted on the website that would be helpful?
Well, we did have a post of our survey results that said 7 in 10 people that responded felt frustrated because they didn't know how to help someone experiencing mental illness. So we had a link on that post to what you need to know to help a friend. And they suggest that the 10 common warning signs. So sometimes people won't tell you what's wrong, but there are like some signals that you can see if a friend is feeling very sad or withdrawn for more than 2 weeks. So, they might be sad or upset about some temporary thing, but, if it lingers. And so there's a list of about 10 really warning signs that you need to take into account. And then if they don't want to talk about it, sometimes you can start the conversation by just saying, tell me more about what's happening with you. Maybe if I understand better, we can work things out together, kind of thing. And then offer support. Like, I really want to help. What can I do to help you right now? Asking them what they need for help, I think is important. And then just be a friend. Don't say things like, oh, you'll get over it. Or, just pull yourself up with your bootstraps. That's not helpful. So, just tell them you're there to support them through whatever they're going through.
Well,
and encourage them to get help.
Who decided, Donna, because I cannot wait to check out the different things that you did on your website. I think the interviews are going to be very powerful. How did you put that together?
The video?
The whole thing, in terms of we're going to have these different segments addressing these.
I have an great team of people, just an awesome team of people that I'm working with from Munson Healthcare, from the Behavioral Health Initiative, Groundwork Center, and I have some people, a person a friend of mine that we are working together to, I guess, to officially get a NAMI affiliate going in Wexford and Missaukee counties, and then some people from Club Cadillac, which is a recovery center run by Northern Lakes Community Mental Health, to help people through the recovery process after a mental illness. And then also there's a person from Northern Lakes Community Mental Health on our action team. So we all get together, we meet once a month, and we, talk about what needs to be done and the steps we're going to take, and it's a process. So with a great team, I think we're accomplishing a lot.
I know this is outside of your purview, really, but as someone who has put together all of this information and compiled this information, would you suggest that if there are parents out there who are, looking for a high demand area that their kids could work in, or maybe some teenagers who are listening right now who want to do something to better the world, would you suggest that they go into this line of work?
Well, I'm not sure. That's a tough one. But yeah, I would encourage people, if they feel like they want to help people in that way, I would say don't be afraid of it. Go for it, because we do need mental health providers badly. And like you said, we even need facilities. I've heard horror stories of people being stuck in the ER for a week until they find a bed in a behavioral health unit. So.
And it's at that point when minutes mean everything.
Right.
You need help right now. You don't need help next week.
Yeah.
Right.
Donna, and I know we're not going to get into, the cause and all of it, because there's so much to it, but is social media, where did that get addressed anywhere in the survey?
Oh.
Okay.
No, it doesn't, but that's a really good point. And I think maybe we should think about that, our action team, because I think social media is impacting, especially our youth, a lot. And and there's, with the bullying and everything else, it's
well, and not only, Donna, not only the bullying, but what people put on social media is the absolute very best version of themselves.
Right.
And Katie Katie is laughing here because she is a social media resistor. And I have been on social media. I've been on Facebook for like 13 or 14 years. And sometimes I wish I could get those 13 or 14 years back. And especially as a teenager, it's going to be very, very hard not to compare yourself to what you see.
That exactly.
Yeah.
Yeah.
So that is a whole nother survey for District Health Department number 10 to do right there.
Well, you guys have opened up a new can of worms.
Oh, sorry. You're a busy lady.
That's great. That's great.
It's actually a good thing.
We also want to bring I should mention too, we also want to bring a program from NAMI to the schools. It's called Ending the Silence. And it's
Hey, Donna, hold on just a second. Can you explain what NAMI is before you go further? NAMI,
it's the
right?
National Alliance for the Mental Illness.
Okay.
Got it.
Go ahead.
And so they have this program, Ending the Silence, which is to be done in the schools. 2 facilitators, an adult and a young person, high school senior or
someone
age like 20, kind of a peer.
Someone close to their age.
Yeah.
Which is very important.
Mental illness, yep. And they go into the classroom and they talk about their experience and how they felt and how they got help. And it's very, very powerful. And a lot of the students come back and want to talk to them afterwards and say, oh my gosh, I've been feeling like this. This really helped. They also meet, before they go into the classroom, they meet with the school staff and administrators and give them some education and talk about what they're going to do. And then they also have a virtual meeting with parents that want to be involved.
So
That's
is that a
amazing.
new program?
It's not new, but it's new to hear, to up here.
Mm-hmm.
So if we have some educators who are listening to us, some administrators, some school folks who are able to make these kinds of decisions, how can they get that into their schools?
They just have to reach out to us, to me. We're trying to get trained, and there's NAMI Grand Traverse actually has the program. They have the trainers, they have the facilitators, and they've gone into the Traverse City High School.
Okay.
And they set up a booth afterwards, and they had 1,000 students come by their booth and talk to them. So
Incredible.
And I can tell you that would happen at every local school
right.
if that was presented. Yeah.
So if the schools are ready for it, we're ready to provide it. So
Okay.
What a resource. That sounds amazing. I mean, the thought of a young person sharing the story and being that vulnerable and then having, their support with these adults around. I mean, it sounds like a great format. And then because the students that are watching relate to the student, but they also see that adults care too.
right.
How are they finding someone who is willing to open up and share to that level? Because at that age, that is hard.
Yeah.
Mm-hmm.
I don't know who they found for Grand Traverse. We have a person in mind, the person who participated in the video for us. She would be awesome at this stuff. I think you can seek out one person, because when they go through this, I think they want to help other people.
Oh, sure.
I can tell you a lot of former students who struggled with anxiety and have done well as they have adjusted into adulthood. I have suggested to a lot of them, be a counselor.
Mm-hmm.
Yeah.
You know how it feels
Right.
to
Yes.
be down in the dumps. You
Yeah.
know what you needed to do to pull yourself out of it, or take the assistance of others to help get yourself out of it. And a lot of them say, I should really look into that.
Mm-hmm.
Yeah. Yeah.
It's true. And us old folks can learn from the young folks too. I spent the weekend in Chicago with my best friends from college, and one of them saw a tattoo on my daughter's ankle that said, "Keep going." And when we left, my daughter, she looked at me and she said, "I'm copying her tattoo." And I thought about her journey, which has been difficult. And I thought, that's, okay. And so I said, "Can I please get a snapshot of that tattoo so that one of my best friends can get it?" And so again, like you said, if you can share the stories, then other folks can maybe gain strength and knowledge and next steps for what they need to do in their journey. Donna.
Right.
So
you feel like you're the only one that's feeling like this, and it just helps to know that, it's not abnormal. You're not,
Right.
weird. You're feeling something that a lot of other people have felt. So.
Tell us, we have about 90 seconds left. So tell us, Donna, in our last little bit here, where folks can go online to find the results of this survey and find these tips and these ways that they can help.
Okay, they can go to Northern Michigan Shire, and the Shire part is spelled CHIR.org, and then / Behavioral Health Initiative.
And what we will do, Donna and Katie, is we'll find that link and we'll post it on the Cadillac Unscripted Facebook page and the 1079 CDY Facebook page as a follow-up to this, so people can find it.
Awesome.
And Donna, I have a personal request. I would like to talk to you on the show a year from now, or whenever you think appropriate, when you've had time to completely digest and launch all of this information and get your action plan in play, because I think you're going to have a great success story to tell us about what the community did with your information. But thank you so much for addressing a critical need.
Well, thank you for this opportunity to get the word out.
That's Donna Norkoli.
I appreciate it.
Thank you, Donna. Regional Health Planner, Coordinator for District Health Department number 10. You are invited back. In fact, if you ever do put out that social media questionnaire, I want to hear the results of that too.
Me too.
All right.
Okay. It's a deal.
It is. Thank you, Donna.
Cadillac,
Thank you.
Cadillac
Bye.
Unscripted is sponsored by Independent Bank on 107.9 CDY.